All right, we have another case. We have more questions. So let's get 2 minutes on the clock and your time starts now. All right, so time is up, and I think just about every practice exam, every exam I've seen has some kind of question around menopause. So this is a topic the college really wants you to absolutely ace and know like the back of your hand. So of course, what are the benefits of menopausal hormone therapy? So MHT is the replacement term for HRT. For a woman like Emily, here they're asking for 3 things. We've got many more than that. So, relief from hot flushes, relief from night sweats, relief from sleep difficulties, lowered risk of osteoporosis. And here's where reading the question comes in handy because, yes, there's things like improvement in mood and improvement in vaginal dryness or dyspareunia, but these are things that are said, what additional potential benefits? And so, given she's already specified that she's experienced those things, but they're now well managed, you would not be getting marks for those. So again, even though this is a almost kind of free marks kind of question, always make sure you're not falling for any traps or any misdirections, shall we say, to get those marks there. Hopefully you did well. Let's get 2 minutes back on the clock for the next question, and your time starts now. And time is up. Of course, we have answers here for you, and of course, the ones we're all going to know about: increased risk of blood clots or deep venous thrombosis. Definitely going to score you marks. There is a slight increased risk of breast cancer, but certainly nowhere near what was stated from earlier studies, which were on markedly older populations using different hormones at very different concentrations, much higher than what we use these days. Now, there is a slight increase in the risk of stroke, and again, the further from menopause you are, the greater this risk is. There is an increased risk of endometrial cancer with estrogen alone therapy, which is why you would have to note that yes, this is estrogen therapy, but we are combining it with a progestogen for that protective factor. And as well, something that I think is really worth noting is that in most cases, the risks are outweighed by benefits if commenced within 10 years of menopause. So I think that's something that is, in terms of the important risk or side effects, this is still something that I think would get your mark because it's important information to convey around these risks and side effects. Hopefully that makes sense. Of course, we are almost at the end of tonight. We still have a question to go. If you want more information around these things as well, I would really, really encourage you to check out the Australasian Menopause Society, which have some absolutely fantastic information there. Of course, I know a lot of people also use the Jean Hale's website, which I think is probably a little bit more patient-friendly, covers many more topics outside of just menopause. And so if you have a patient that might particularly browse things around and you send them there for information around menopause, but on the way they happen to find out a bunch of other things that could be beneficial to their life, win-win. But certainly straight to the source here is the Australian Menopause Society. So Australasian, I should say, Australasian Menopause Society. They also do have some great handouts which print out quite well, and for that, hey, we've talked about a lot today, here's something to take home and read through. I use all the time. All right, last question. Let's put 2 minutes on the clock, and your time starts now. All right, time is up. And again, this is one of those questions that has a lot of people licking their lips over things they could do. And of course, preventative health is a GP's bread and butter. So things that you could be taking the opportunity to do that are going to give you more marks would be things like encouraging to complete a fecal occult blood test to screen for colorectal cancer. 2 marks, boom. Encouraging cervical screening if due. 2 marks, boom. Encouraging mammogram to screen for breast cancer, 2 marks. Clinical assessment for risk factors for osteoporosis, 2 marks. These are all those big ticket items that come straight from the RACGP Red Book, preventative health measures in general practice. Now, you will note though, these things are worth 2 marks because they are those big ticket items that you really want to make sure someone that's coming into 50 years of age should be having done. Of course, you've got your more bread and butter day-to-day things that would get you some marks, things like measuring blood pressure, ensuring immunisations are up to date, reviewing smoking history, alcohol history, review cholesterol and other lipids, review OSDRISC, inquire about stroke or TIA symptoms, raise awareness of early signs of skin cancer, visual acuity changes, glaucoma risk, review height and weight. Yes, they're also in the Red Book, also in the recommendations for what we should be doing. But I think this is where actually showing that consultant level understanding, consultant level knowledge of, these are all things that we could do, they're potential answers, but where are you going to weight your effort, your time? What are the things that are going to be best suited to help this patient sitting in front of you? So yes, it's good to check their blood pressure, do all those other things, but you have entered them into that age bracket where you can start to do all of these fantastic screening programs that could set them up for the rest of their lives. So again, you would get more mark for those, and that's where you would focus in on your answers. Now, tied into that here, this is a question that at face value seems very, very simple. But if you notice here, we've got multiple things that are worth 2 marks and lots more that are worth 1 mark. And so you might get valid answers for every single one of these questions, but miss out on almost half of the marks for the question because you haven't shown that prioritization of what's really important for this patient here. And I think this is one of those questions that you go through the exam and you think, yep, I absolutely smashed it, did well, I'm very happy with it, but you may not have given them what exactly they were looking for. So look at that STEM, look at that patient, picture that patient in your clinic and think, what would I do if this was the patient sitting in front of me? Tailor your answers towards that, because that is at the end of the day what they're really trying to assess with the KFP.